So query from Ballarpur, Chandrapur, Maharashtra. Less OPD, need to deal bargaining patient. Lost so many patients because other dentists are doing it less cost. As said by patients are not very sure about the facts. Need to upgrade, but as less OPD, fear of for doing so. As I always say, your questions will always have your answers. So your line written in the bracket is your answer. Patients not very sure about the facts. When the patients are not sure about the knowledge you can say or the intricacies of the dentistry or the dental profession, we need to make sure that we give them the knowledge, we arm them, equip them with the knowledge that is so very desired for such kind of a situation. So patients need to be told all the things at the start. We need to make sure that the start is the defining moment. To clear and you can say settle the expectations right at the start. I yesterday, I'll give you an example of yesterday only. So the patient had come to me 1 week back with his father, went underwent medical investigations. He is a 90-year-old patient, 90, and he is a retired superintendent of police, SP, in my area only. And he is, you can say, very conscious of that fact. He always says, I have been a retired SP. When you had an issue in this area, I was the one who got it sorted. And he's mentioning of the 90s when I didn't even have a shop or a clinic in this area. So that's perfectly okay, because whatever dispute was there, he must have solved it before he was 60. So 30 years back, I was not into practice. He said, you ask, you were there, you were that. So when I politely told him, and of course, we went through the case history detailing and everything. The treatment estimate part went in, the medical investigation part went in. Luckily he's medically healthy, on none of medications, and the medical reports were also normal. So it was the time to actually do the detailing and the consent part. So again, as the Indian mentality is there, he sat down, he said, I want to tell you that I have been a retired SP. Again started with the same, I won't say the rant, but because the oldies have a little bit of memory problem, so they tend to keep repeating the same thing. So I understand that part, and I don't absolutely mind those things. So he kept on mentioning, I am a retired SP, I have been instrumental in making this, you can say that the common resolution between the dispute which was there among the shopkeepers and everything. So I said, uncle, what do you want? Please tell me very clearly. I want that, my money is very hard earned money, you should not be doing it. And I was thinking, sir, 30 साल आपको रिटायर हुए को हो गए हैं, हार्ड एंड मनी तो सबका ही होता है. इवन आई हैव एन हार्ड एंड मनी इन फ्रॉम माय प्रैक्टिस. सो इट्स नॉट अबाउट द हार्ड एंड मनी पार्ट. So it's about you can say realizing that it is the time you spend on yourself, and his teeth are really in a bad shape. So I have given in an estimate of about 80,000 or so, and he was like, we need to reduce this amount, we need to reduce this amount. So yesterday was the consent signing and the discussion part. I'm supposed to begin that case from Monday onwards. So I told him very clearly, and imagine, I told you the case started last week, still not started with the treatment, still the paperwork going on, still everything is going to be a long case, money involved. So the expectation setting is right. So I actually sat down, I you can say made a, you can say made him made his son sit quietly outside, and I was talking one to one. I gestured him to please don't speak in between. So I had a one-to-one talk with that patient, with that senior citizen, super senior citizen, I would say. So he said, I want, you should be doing the best of the treatment, you'll be doing it. Said, uncle, I have told very clearly, it is mentioned in your consent form also, your treatment estimate in is inclusive of these, though it is of these things I've given you, these many root canals, these many crowns, these many, you can say restorations, these many, say whatever procedures I've counted, these are inclusive of that. So, and this includes your crowns based on the basic crowns that I do. He said, I want the best of the crowns, I want this, I want that. He was, because having a too much of expectations. So I tried to mellow down the expectations. I told him very clearly that if you want the best things, then your estimate is going to surely go much up, because in all the procedures that you're getting done, the crowns carry the 75% of the cost. So even if you choose for, you can say, a better crown, which is valued at 10 to 20% higher cost, your estimate for the treatment is going to go up by 20% or nearly 15-18% as well. You need to know that. And I've given you an estimate for this much amount of restorations or this much amount of work to be done. If your restorations turn up in bigger number, then again your estimate goes up. So you need to be very clear about that part. If you're not very clear, let's sit down again, and because I cannot give you 100% exact estimate of what exactly to be done. I've given you a close by estimate, and my estimates are usually in that window. I rarely, you can say, cross my estimates, but yes, 10% variation is always there. So the patient understood that, and the patient's wife was sitting very quietly with him. So after my explanation, she told him, आपको काम भी अच्छा करवाना और पैसे भी नहीं देने हैं, ऐसे थोड़ा ना होगा. काम आप कहते हो बढ़ा दो पैसे, आप बोलते हो घटा दो, तो ऐसे नहीं होगा ना. दोनों में से एक चीज चुन लो. And I didn't have to say anything. I just explained him the way I do it. The patient's wife told him, and he was now settled, now melted down, and he signed the consent form, and we're supposed to begin on that. So it's about the detailing part. People will tend to bargain in the end, but if we set this parameter right at the start, how about it? The only thing that stops us is the fear, the insecurity of losing the patient. And if we can overcome that fear and insecurity, sky is the limit. People have bargaining problem because they nothing have in return. They don't have a witnessed consent, they don't have a treatment approval form, they don't have a actual treatment done list. So people tend to believe that if patients are bargaining, then the patient is at fault. I believe if the patients are bargaining, we are at fault because we were casual and not detailed enough. We were casual and detailing to the patient and were overall less detailed in telling the patient about the detailing of the treatment. So if the patients are not very sure, it's your responsibility to educate them that why are you costly. At the end of the treatment, if you give them a bill in the hand, none of your, you can say, none of your explanation is going to satisfy the patient. So always set the right kind of expectations at the start before you go in for that. So need to upgrade, but as less OPD fear of doing so. You upgrade because you need those things in practice, maybe it decor, be it equipment, be it materials, or be it anything else. You don't fear because of less OPD. It's not that you have to earn from that. And that fear comes when you are not actually putting money back into operations. I mentioned that at least 10% of your money should be plowed back into your profit, should be plowed back into your practice, which means that even if you make an immediate purchase or not, even if you can say do something similar, you can say in terms of decor, terms of equipment, terms of materials, or terms of any upgrade in your practice, can be full chair as well. So you are pretty much sure that those things are covered and you have taken care of that. So if those things are taken care of, there will be no FOMO. And if there is no FOMO, then you are automatically upgrading. I hope that answers your query.